Hi, everybody. My name is Layla, and I'm the Health Education and Engagement Manager here at the International Foundation for Autoimmune and Autoinflammatory Arthritis, or we just say AiArthritis for short. I want to take the time to thank you for taking time out of your day to watch our inaugural race-a-thon. And this is going to be one of the segments that are going to be pre-recorded. And I'm super excited to introduce to you all my mom. I'm going to let her introduce herself. But today we're going to be talking about what it's like to be a parent of someone who has an AiArthritis disease. I was diagnosed with lupus when I was 12 years old. And I also had precursors of lupus before then. That was immunothrombocytopenia, which was, our first kind of really big medical scare that I had as a kid. And so she will kind of go into that and how she dealt with a lot of those situations. And also, she happens to be a mindfulness and mindset coach, nurse coach. She's an RN and had worked in on the field as an RN for the past, 10, 15 years and is now transitioning into doing coaching. And so she's going to also talk a little bit about that. So I'm super excited again to introduce my mom. And, a lot of people usually say that she looks like my sister, but you know what? It's okay. So again, if you want to introduce yourself.
Hi guys, my name is Mervik Peraz Lee. As Layla stated, I am her mom. She is the eldest of my three kids, three daughters. I am a registered nurse by profession, as she stated. I am based in San Francisco Bay Area, as you could tell from my background, and I'm excited to be on this and just to share our experience and just shed light to everyone or some people who are probably going through the same hardships that we did and obstacles, and just to shed light on how we handled it.
Yeah, absolutely. And so, as I said, she is the mom of someone who has an AiArthritis disease. I have a systemic lupus erythematosus. And then, just recently in 2019, got diagnosed with lupus nephritis, and just recently, earlier this year, with Sjogren's syndrome. And so, I just wanted to know a little bit of how the diagnosis journey and kind of all of that affected you and how, like, kind of the steps that it took for that to happen.
Well, as you stated, the early journey started with not lupus, but ITP. And I believe you were 7 at that time. And initially, you showed symptoms. The initial symptoms were large bruises along your legs and actually all over your body. And it freaked me out, to be honest with you. But as a mom, I also did not want to make you nervous. So I had to stay calm and collected and just to calm you down, first of all. But in the inside, I was also very nervous. I think I told you your grandma, who passed away before you were born, she was diagnosed with leukemia. So that's the first thing that came to mind, because of the bruises, and those were some of the symptoms that I remembered her having. And so my first initial action was to obviously contact your pediatrician and bring you in as soon as possible. And when we had your labs drawn, and that's when I received that call from your doctor that you're to go to the UCSF at that time, to proceed to UCSF immediately, because your platelet levels were extremely low. Normal platelet levels are 145,000 and above, and at that time it was 7,000. I think
Wow.
you mentioned it before. It was 11,000. No, it was actually 7,000. And so back to also into mom mode, to not freak out. And I just tried to explain to you, and I have been explaining to you in layman terms that, what is going on, in order for you to know what to expect. So, for them to draw blood, and, after that was your hospitalization. And so that was a journey in itself that took a while, because it took a while for your platelet levels to go up. And it took several months, but that was the precursor of your lupus, because the whole journey going back and forth and getting your labs drawn every 2 weeks, every month for, gosh, I think 2 years, 3 years.
Yeah.
Um, it was um, it was becoming a routine actually, and which was good in a sense because at least you were at ease with what to expect and what to expect every time we went to UCSF. But when we finally found a drug that worked, that kept your platelets up, which was rituximab, that stabilized everything, and the blood draws minimized to from once a month to, I believe it was once every 3 months, and then once every 6 months. And we were pretty happy with that because it seemed like an ongoing test of different medications. So for a while there, we thought we were, home free. And then that's when you were showing, I believe it was 3 to 4 out of 11 factors of symptoms of lupus. And that's at that time you weren't officially diagnosed, which was, I believe your pediatrician did a good job and explaining, not jumping right into the official diagnosis, because it was 3.5, 3.5 to 4 of the factors that you had at that time. And I think with her just not minimizing it, but really also not jumping the gun and officially saying you have lupus, it kind of prepared us, and at that point, because you weren't displaying any of the symptoms.
That's
And
what I was
so
going to ask about. It was originally the blood work, right? That was the
mhm,
initial
yeah,
markers. So that's like completely backwards than a lot of people that get diagnosed with these diseases.
yeah.
It was just so happened that I was already being monitored, and so they
Mhm,
saw the all the inflammation markers that had to do with lupus. And so
mhm,
I always talk about how it's so unique how that situation happened. And one of the things I wanted to mention was that you weren't a nurse back then.
mm-mm.
So you were
No,
thrown into all of this.
actually, I was taking prerequisites, and no, I wasn't even in nursing school then. And I remember while you were getting in your infusions, I was there with my textbooks, doing my homework and whatnot. And really, a lot of the uh, your journey with your ITP and your lupus really helped me out with my nursing journey, because it was, real life experience as opposed to just solely textbook. So in a way, it's a blessing in disguise, because even though I didn't take care of a lot of lupus patients, but I know how autoimmune disease was, and that was the hardest. That was the hard part. With I guess accepting that you had lupus, because we really didn't, like I said, we didn't see your symptoms. In hindsight now, we were thinking when you would be very tired during finals and when you're in high school. And then, but as a mom, that also, autoimmune disease mimics certain symptoms, right? And so that in itself is already difficult to hone down as to what you have. But throw into that, you are a teenager. So as a mom, from a mom's perspective, I didn't know if you were just being rebellious or just being lazy. You didn't want to, you're just being a normal teenager. So it was hard. It was hard. And I know at some point, when we did get that diagnosis, or when you had your first really major flare up in 18, it was hard because we never came across any of these symptoms. And I remember
No.
you calling me at work. You were freaking out because I know you were having flu symptoms, and which didn't really, it didn't trigger anything within me. I just thought you were just having a viral infection. But when you called me freaked out when I was at work, um, I remember you saying your hands and feet felt like they were on pins and needles. And I couldn't figure it out. I couldn't. And, of course, I came home and brought you to the ER, which we both know that was, it was, I don't want to minimize what they do, but it was, at that point, it's helpless because they really couldn't figure things out, you know. I mean,
And that's a common occurrence too with a lot of people who have AR arthritis diseases, is that, you know, when you go to the ER, and this just happened to
mhm,
me last year, when you go to the ER, they don't take you seriously.
no,
Your injuries or your symptoms that you're having right now are not on the list of on the high triage, you know? And
yeah,
that's what can be very, very frustrating, because a lot of people wait a long time to go to the ER until they're
mhm,
really, you know, feeling it and they need like help right now. And so
mhm,
yeah, that can be really tough too. But yeah, I also wanted to sprinkle in there too that even all in the middle of the ITP and the lupus diagnosis, I
mhm.
also had two slipped hips
Oh
that
yeah,
happened during that time too. And like now, like looking back, sometimes I think maybe it could have been like, you know, somehow related to another, you know, like hypermobility or some kind of other autoimmune disease too. Cause
mhm,
I'm like, what else could cause all these different things? Like it, they had to all be somehow connected and not
mhm,
just, you know, separate occurrences. Because like I said, I did some research recently and I saw that ITP is, you know, it's like 1 in 10 people who get ITP develop lupus. And
mhm,
so that's, you know, that's something that they've noticed a pattern in also. And also you mentioned the viral infection of my first like big flare. And I was looking back too that I had a viral infection when I was really little, like 4 years old, and I
Bell's
got Bell's
palsy.
palsy. And I just am thinking everything that has happened really big in my autoimmune journey was all triggered by viral infections.
Yeah.
And, you know, that's something that we all don't connect the dots to until you see it in hindsight also.
Well, how would you, especially if you're not in the medical field,
Yeah.
you know what I mean? And we weren't at that time, even if you are in the medical field. Now that I'm a nurse, I've been a nurse for 15 years, it mimics. That's the difficulty part of, you know, autoimmune disease. It mimics symptoms, which, you know, some providers, some nurses could think it's just a regular viral infection when in fact, even when we were at the emergency room at that time when you had your flare up, they did just regular labs. I mean, who's to say that to specifically look for your complements, right?
Yeah.
And so all your labs came out fine. They did an EKG on you. They did all the diagnostic tests that they could do, and they were stumped. And you know, it's frustrating because here you are, you go to a medical center and you go to providers, you expect them to have answers. But now that I'm on the other side of things, it's really hard, especially with an autoimmune disease, because it's such an umbrella. You know, it's such a big umbrella with all these symptoms it falls under, that it could be anything.
Yeah,
And
no, definitely.
unless you work closely with a rheumatologist, but how would you know if you weren't diagnosed yet? But I think I don't know whether it had anything to do with it, but Dr. Stevens, uh your pediatrician, she just so happened to have, you know, she's married to a rheumatologist.
Rheumatologist, we just found
So
out recently.
yeah, exactly. So maybe that was you know, to our advantage. That yeah, and that's when she came to the to when you
To the
were
hospital.
in the
Yeah.
hospital, and that's when I don't know how, I can't even remember how she came about checking for your compliments. I mean,
You would think I had
because
already
even
been diagnosed with lupus for 6 years at that point. You know what I'm saying? Like
yeah,
when I was 18, I was diagnosed at 12. And so I don't know. You know, I think one of the things is that's really big that we're working on in the next few years here at AiArthritis is education for general
hmm,
practitioners, for physical therapists, for nurses about how to find the signs of an autoimmune disease and to really like educate them so that they believe these people when they come in with, you know,
hmm,
expressing these different symptoms. Because these people, like, you know, I found out, you know, my fiance's cousin is in medical school. She said we spent 2 weeks on rheumatology. 2 weeks
yep,
of the whole curriculum in
yeah,
medical school was on rheumatology. And so it's like it's very, very uncommon to find someone who's very expertise in autoimmune diseases, even we live in a big city. We live in a
Mm-hmm.
very populous area, but imagine those living in rural areas and things like that. It's
Mm-hmm.
they could be traveling
Mm-hmm.
6, 7, 8 hours just to get to a rheumatologist. And it's like it's
Mm-hmm.
something that really needs to be more educated about.
And throw into that, like during this journey, we also found out that there's not many rheumatologists out there.
Mm-hmm.
So with, the lack of providers and the lack of education, it really is, it's hard. It's hard for that individual who's going through it. And and it really does take proactive in your part, and which you did. I'm so proud of you. You've done so much research, and I just wish, that the people that, those patients that are going through with an autoimmune disease, that they also take an initiative to be proactive. And I think what AI arthritis is doing is just shedding light and just being able to plant that seed with, the patients who are going through these symptoms, that will just start the ball rolling in educating themselves and just being proactive in their care. Because if your voice is all you have, you know what I mean? And when I hate to say it because I'm a nurse myself, but I think it also with individual providers that you come across, if you're not, if you're not proactive, then first of all, how were they to know if you had any questions? If
Mm-hmm.
it would be great if you come prepared with questions. And I tell my patients that before they go to their, see their providers, make sure you write down questions, because a lot of people like myself, you just get nervous, not nervous, but you have so much in your mind that you tend to forget until then you don't remember until you're done with your provider. So it's
Mm-hmm.
one of my best advice is for patients to have preset, you have their questions written down prior to going to their providers, so that they can really be proactive. And just being, that's empowerment for the patients, and just being able to have that voice, because you really have to fight through this, especially with not many providers are educated with autoimmune disease.
Absolutely. And I think you've done a really great job of showing me by example how to use my voice because I mean, okay,
I
being
don't know, that can go, that can backfire sometimes.
being serious here, it's been like, how many times you've had to have a stern talking to my doctors in the ER, my doctors whenever I'm hospitalized, just advocating for me to get my own room sometimes and things like that, where it's like, I am here because I have an autoimmune disease. Why is there someone in the same room as me that can have something that I can contract and different things like that? Or
Mhm.
last year when I went to the ER when I had COVID and they had me sitting in a tent outside
Mhm.
in 50-degree weather. I was there at 4 p.m. and didn't get seen and got brought into the ER until 9:30 p.m. I was there for more than 5 hours sitting outside. And,
Mhm.
when you're in those situations, a lot of patients shut down because they feel like, okay, they're the providers, they're the doctors, they know what they're
Mhm.
doing. I'm just going to shut up and listen, and I take that sometimes, and that's what I do. But really being here at AiArthritis has empowered me to not do that anymore. And I used to, really sometimes used to be like, okay, mom, like calm down, it's okay. But and now I understand. Like
Yeah.
I understand like having to advocate for myself, especially I've been living
Mhm.
away from you for almost 10 years now. Isn't that crazy?
I know, I was
I've,
just thinking about that.
yeah, I've been here in Southern California for about 10 years and I've really had to learn how to advocate for myself and take everything into my own hands because mom's not always going to be there to, have your back and defend
No.
you. And it's, my
Mhm.
mom really does want to be here all the time whenever I have anything going on with my medical stuff. And I really appreciate her for
Yeah.
that. But I also do have to learn how to have my own voice and be able to advocate for myself because you
Mhm.
know yeah, not everybody out there has a mom that's willing to do that or can do that also because
Mhm.
you get to use your own knowledge to be able to let them know like what's really going
Mhm.
on and that's an
And
advantage.
I never introduced myself as a nurse, and that's one
Mm-mm.
thing I always do. I don't ever introduce myself as a nurse. but I do let my voice be known. And like you said, you have to be your own advocate. And now that you're an adult, you're doing a great job. But when I was going through it, I have to, because you just can't sit there and take everything for face value and just accept what is given to you, because you have to, and there's a way to go about it without,
Of
causing
course.
a scene or anything. You have to be just, you just can't take no for an answer if you feel that, that's not settling right with you. And you have to be your own advocate. Really,
Sometimes,
that's the bottom.
it's fine if they think you're a Karen, it's it's not that big of a deal. No,
No,
but
and
yeah,
it's
no,
funny because,
definitely.
and I think sometimes we've thrown people off because, like you said, a lot of people think we're sisters. And but when I start talking, and they could tell, and me as a provider can tell, it's either they're in the medical field, or a family member is in the medical field, or they've done their research, which you
Hmm.
have. So that's why you can carry your own weight when you do go now on your own. But of course, like there's times that I insisted. I know and I've raised you to be very independent, which also, is good to when it comes to you being your own advocate. But for instance, when you had to have a biopsy when your lupus nephritis came about, I just had to be there, because when you're in that situation, especially you, the patient, I know you're strong, but you also need that. It doesn't hurt to have another person to be your advocate, because you could feel, lethargic from the procedure in itself, and, or the medications. So it's always good to have someone by your side. And at that time, not only did you have me, but you also had your godmother, who was
I
also a nurse.
know, who's
So
also a
there you
nurse.
go.
I know. Yeah, and I mean, it's really, I'm really fortunate in that situation because, I had, well, my boyfriend, he was my boyfriend back then, but he had no idea what was going on. He was scared out of his
Mhm.
mind, and he wanted to support me as much as he could, but you can't sometimes, especially if you have no idea what's going on. And it's like, I felt like, oh, like I'm an adult. Do I really need my mom here? But once you were
Mhm.
there, and once we did like have situations that were happening when I was in the hospital, I was like, thank God, like I don't have to like yell at these people by myself. I'm like,
Yeah.
I guess you get so frustrated when you just don't feel like you're being heard. Even just something as simple as like, can you make sure that the person that's doing my heparin shot knows how to do it correctly so I don't get a big giant bruise on my arm? Like, it's just
Mhm.
little things like that where it's just like they get thrown off when you have your own, when you have some opinions, but at the same time it's like, I really need to know what's going on with my body and with my own care. And I think that that's something that
Mhm.
I've really learned, um especially in the past 5 or 6 years. I did want to
Mhm.
ask you though, like I mean, throughout the whole journey, what do you think was the toughest part of being a parent with someone who has lupus? Like, you can name a few, or if you have one in general that you think.
Yeah, I think there's a few. I've mentioned just having to put up a facade and not, so you don't panic. You as a, when you were younger, I just had to make sure I looked cool, calm, and collected. But in the inside, I was freaking out. But that was the hard part, because I didn't want to convey that, you just need to stay calm. And I think the hardest part was when you had to move down, as it's bad enough that it's tough enough that you were going away for college for the first time, and just 2 weeks prior that this is when your first major flare up occurred. And to have you, even though you were within the same state, but I wasn't there. And once you turned 18, I couldn't access any of your medical records without your consent. And it was hard for me because I was going through the separation anxiety, as a regular mom, but now as a mom of a lupus patient, now you had to establish everything that I had to do for you. You had to establish your primary care doctor, and then get a referral, for a rheumatologist, and all while trying to assimilate to college life. And it was rough. And I don't know if you remember, but I even offered to have you stay home even for a semester while you got over this flare up or just getting adjusted to,
Just even
the
starting treatment, because
medications.
yeah, I
Mm-hmm.
didn't even start treatment yet. It was I don't know why I did it. I was just stubborn, to be completely honest with you. I should have went
Yeah.
home. I should have probably, I wouldn't have failed my class twice if I wouldn't have been
Yeah.
stubborn. But I think it was a really good learning lesson for me, though, to understand that I needed to do all those things for myself. And
Exactly.
yeah.
I think things happen for a reason. You didn't want to come home, okay, and I couldn't force you. Half of me was, of course, I was proud that your resiliency was, evident, but at the same time, you being stubborn and trying to push through this, that could have also exacerbated more flare-ups because that's causing you stress. I mean, now you think back at 18, you were dealing with all those, getting your, established and referrals, and not many 18-year-olds even think about those things.
I'm like, yeah, Janessa's 18 right now,
Yeah,
about to be 19.
exactly.
I
Your
couldn't
younger
imagine her
sisters,
doing that. Yeah.
no,
Janessa,
looking,
I deal, yeah. Janessa is actually also our social media assistant here at AiArthritis. So, but so she's also learning a lot about these diseases and things like that. But yeah, I couldn't imagine her do, like, setting up her own doctor and doing all those things at the age that she's at now.
no.
So I think about it and I'm like, yeah, I was crazy for, being able to do all of those things. But again, like you said, it's about resilience. And one thing that I've been talking to a lot of people about recently is, oh, like, when people are like, oh, you're so strong, but like a lot of us, we don't have the choice of being strong or not. Like, you kind of just have
Mm-mm.
to figure it out and learn and, roll with the punches, because that's all you really can do. And so,
Yeah.
yeah, no, I totally get, like, I couldn't imagine how, like, now I just became a dog parent, and with the separation
Mm-hmm.
anxiety, even just from that, I'm like, I couldn't imagine after, me being with you for 18 years and then all of a sudden just not. And on top of that, all of my health issues, it must have been really
Mm-hmm.
hard for you.
I mean, I started of course, I questioned myself as a parent several times. It's like, am I doing the right thing by, letting you be independent and, run your journey with a college life, or am I being too lax about it? And I also don't want to be hovering over you. You know what I mean? I mean, I've lost your grandma. Your grandma passed away when I was 16, so I've been independent myself. So I had no qualms that I raised you to be independent and you could do it, but at the same time, then I was thinking, am I being a good mom by letting you do this by yourself? But I couldn't force you. I offered, and you insisted, which I think in hindsight, it prepared you for everything else. I mean, it really made you mature, and
Absolutely.
which is a good thing. Going back, one of the hardest ones, another hardest part is when you were diagnosed with lupus nephritis, and when I asked you at that time, I was working as a post kidney transplant
Ironically
coordinator.
enough.
Yes. But I was still new in my role. And of course, one of my daily task is to go through patients' labs. And so I just prompted you to, okay, why don't you send me your labs? And that was another don't show you're freaking out moment, because your creatinine was at an ultimate high that I've never even seen in my patients. And that freaked me out, but of course I still couldn't show that. And yeah, that was one of a scary journey. That's why I insisted in being down there for your biopsy, because
Yeah, and you had to
I
beg
I
me to
had to
go
do
on
something.
disability too. That, like, you had
Mm-hmm.
to beg me to go on disability. I was being so stubborn about not losing time at my job and wanting to be there and all those types of things. And it was just a month that I was on disability, and
Mm-hmm.
I
You're
really
resisting.
should have been I should have been on disability for a while. I think I really never took my lupus as seriously as I should have for a really long time. I think up until after my lupus nephritis diagnosis, I think that's what really made me take it even more seriously to another level. And knowing that, you know, again, there's a lot of people who they get diagnosed with lupus nephritis, not even knowing that they had anything. And that's when they, you know, they need a kidney transplant already. I was lucky enough
Mm-hmm.
that we caught it early enough. Even though it was still class 4 and class 5 nephritis, it was enough where we were able to stop it in its tracks. And now my kidney levels have been great for the past 2 years.
Mm-hmm.
And so just like having to go through all of that again, and you know, being a part of that process as an adult, I definitely take things a lot more serious now and keep an eye on all my labs. I know what all of my labs mean now. I know what I need to look for,
Mm-hmm.
and what should be low and what should be high and things like that. But yeah, that I can imagine how scary that was for you seeing those numbers. Like it was the protein, the
I'm
protein
sorry, the
ratio
protein.
too. Yeah.
Yeah.
It was very
And
high.
the urine protein creatinine ratio. And, it's, that was also one time that you had another time that you had to be your own advocate, because then you had to push to really see a nephrologist when I told you just you need to go see a nephrologist. And so, and I think given at that time your age, they really didn't take you seriously, or they were lax about it. And then you really had to be very assertive in getting to see a nephrologist. And that's what got you tested with those labs as well.
Yeah, with
And
all
and
of
like I
that.
said,
Mhm.
it's just in hindsight, if people who don't have anyone to advocate for them, it's really, it really just you just really need to advocate for yourself. But then again, what would you know? And this goes back with the autoimmune disease. What would you know what to look for? You know what I mean?
Mhm.
And it's just educating. I think I would highly recommend everyone who's going through who's suffering through some type of disease is to just be your own advocate, and just do research, and just be your own voice.
Absolutely. And we kind of touched on this question a little bit. But now that I'm an adult, how involved are you still in my care? Or, you know, from 18 until now, I'm 27. So how involved have you been in my care?
Well, I mean, in the sense, I'm involved with, when you call me, if you talk, if you saw some type of research, we discuss it, and we think now in hindsight, and we compare it with what you were going through in the past. I I still want to be involved, you know, want me to be. I mean, there's times if you do have a procedure, I still would want to be there just to be your voice, like I said, because you are going to be in a position that you're going to be, tired, weak, lethargic, or be under medications that
Hmm.
me as a mom would just want to be your second set of eyes and ears and your voice. Um, I am not directly involved with your care because I think you're doing a great job in especially working with AI arthritis. Every day you're learning something new, not just with lupus, but with other diseases that um it, I trust you. I trust you. And now that I don't need to worry about you not taking your medications as you were in when you were in your teenage years, because now you're the one who's feeling it, right?
Hmm.
So you're actually just doing it to yourself, not to satisfy me. But I really, I think my involvement in your care now is more of a mature level, in terms of we can discuss about it or what your options are out there. And, I think it's a journey both of us that have taken since you were younger. I'm just, now I'm just more hands off, but we still have discussions. So you ask me for my opinions, and we discuss about things.
Yeah, I still call my mom after every rheumatologist appointment, every nephrologist appointment, just to let her know and update her of what's going on. I mean, I'm lucky enough to have been in clinical remission for about 2 years now. And it definitely shows, because I don't call her so much about my medical stuff anymore, and
Well,
things
you
like that.
call me
And
when how many times they missed your vein, and I always have to hear about that.
I know. No, I have really, really bad veins. Like, they're super deep. And now that I get an infusion every month again, it's like the same thing over
Mhm.
and over again of, yeah, oh, they got my IV in two turns this time, or one time.
Mhm.
I actually just had that conversation with my rheumatologist that we were talking about the nurses there at the infusion center giving pressuring me into getting a port, because my
Mhm.
veins are so hard to get sometimes. And they're like, oh, the nurse that always gets your vein isn't always going to be here. And I was like, well,
Mhm.
she's here, so she's gonna get my vein. And my rheumatologist was like, no. She's like, nope, I don't
Mhm.
approve ports for my patients. They're just gonna have to do their job and get your veins, because
Mhm.
it's more of a risk than it is a reward, especially for autoimmune compromised patients. And I'm like, that's exactly what
Mhm.
I thought. So thank goodness
Yeah.
my doctor thinks the same thing. But yeah, it's just another
And
example of using your voice.
yeah, and I agree. I agree with you and your doctor, because it's your care that you're advocating for. It's not to make the nurses' jobs easy,
Yeah.
because there's the higher the risk outweighs their benefits. It's not even your benefits. I mean, it's so risky to have a port, um, just because of what, the potential of, all the complications that comes along with it. It's easier because you're not going to get poked all the time, but I wouldn't do it.
Yeah, unless it's
So,
absolutely necessary. So I agree.
mm-hmm,
We, actually we touched a lot a lot on these questions that we
mm-hmm.
had prepared. So I think that we can go ahead and go into a little bit more about your business and mindfulness, and the journey that you went on, to become a nurse coach for your specific niche. And I wanted you to talk a little bit more about that.
Okay, well, like, we've mentioned, I've been a nurse for 14, close to 15 years now. And to be honest, and just to go straight to the point, I was burnt out. And just like so many providers out there, not just nurses, but the medical field itself, especially after the pandemic from 3 years ago, the start of the pandemic, it really had brought on so much more stress and added tasks to our what is already full plate for a nurse like myself. And so I was going through burnout, and I just decided to take a different journey of my nursing career. And but that's the beauty of becoming a nurse, because there you can go through so many avenues, and you're just not stuck at bedside. You're not limited to just working in the hospital at bedside. There you can work in ambulatory surgery centers or be a school nurse. And this time around, I was intrigued by becoming a board certified nurse coach. And what that entails is, well, the one I went through is 6 months of just, a course specifically on nurse coaching. For basically, it's a holistic view of the patient in a non-clinical setting. And so there's different kind of niche. The one I decided to go to, obviously, is one that I'm familiar with, which is to help nurses prevent or recover from who are going through some type of burnout. And so, which, part of my program is implementing self-care. And one of them is also mindfulness, which, me, I have always been in working out. I've always been doing weights and just really fast, active physical activities. And yoga was not my first wasn't my first choice. But when I came across mindfulness, which is basically doing meditation or breathing exercises, um, being in the moment, I was really shocked myself, because it's really a slow, slower pace of meditation, which I never really took the time to do. And so mindfulness has really helped me recover from burnout. And there's a lot of talk about mindfulness, not just, as a coach, but even the U.S. Surgeon General is an advocate, big advocate for mindfulness. And I like the practicality part of it is because it's not, you have to take a 30-minute time, you have to carve out 30 minutes out of your day for meditation. I mean, which you could, but mindfulness, you could do it within 1 to 5 minutes or 10 minutes, however long you want it to be. But it's just more practical to use, let's say, in a nursing setting, if a nurse is going through some kind of stressful or stressful day or stressful event, they could just step aside for 5 minutes or even 3 minutes to just refocus and get grounded with deep breaths and breathing exercises, and just be mindful of what's going on now, not to worry about what happened in the past or just a couple minutes ago, or not to worry about the future, just being really in that mindset of being in the moment. And so it's helped me out a lot, and I'm really passionate about it, which I'm actually in the process of getting certified with mindfulness teaching. And I think a lot of people, not just nurses, but a lot of people can benefit from it.
Absolutely. I think that mindfulness sometimes like nowadays can also be like a keyword or something that a lot of people say a lot,
Mm-hmm.
but maybe a lot of people don't really know what it means. Can you give like a few examples of how you use mindfulness? I know that you said, like deep breathing and things like, and under other grounding techniques that you use, and like how that could be helpful for patients.
Take, for example, I've never even heard of this until I actually put into play, which is mindfulness walking. So you know me, I've been pretty active, and I've also taken up walking, but I always have my headphones or some kind of fast-paced music to get me in the mood of working out. But mindfulness walking is actually just without any headphones. Um, just going through your routine walk or path that you take, but instead of just listening to music, you're actually in tune with what's going on around you. You're hearing the birds chirp, you're hearing the cars whiz by and everything, and that's just helping your mind to practice just being in the moment. So because our lives are so fast paced, and as a nurse it's fast paced, or even as parents or as patients, you go from one appointment to another, your mind is cluttered with so much things to so much on your agenda. And to actually just be mindful and listening to things, or hearing things or seeing things that you normally would see on your usual walk. And I practiced this when I did my walk, and I didn't notice there was this nice tree over here and this block. Oh, I didn't notice that, they painted their house a different color. So just things that you never would even, details that you never would even pay attention to. And that's the focus of it, is just being in the mind, the presence, the present time, and just taking it all in, and not worrying about anything else in the past or in the future. And I
Yeah.
think for patients that, that's helpful when just being, not having to worry about their upcoming agenda, upcoming appointments, and just taking for what is, happening right now, um, and just letting it all sink in, and just appreciating the present moment.
Yes, definitely. And do you also like does it also have to do with like affirmations and things like
Yes.
that too? I mean, I've started to notice a little bit more too about like my surroundings. One of the biggest things is that, anxiety and depression for lupus are just, it's symptoms of lupus. And for a lot of
Mm-hmm.
other AiArthritis diseases, it's a comorbidity. And so I think that just being able to be more in the present has also helped me a lot with my anxiety. Anxiety that's the definition of anxiety, is just like being worried about like the future and about things that you can't control.
Mm-hmm.
And I think that also is mindfulness of like, trying to only worry about the things that you can control. And I think
Yes.
the biggest thing a lot for patients and for parents too,
Mm-hmm.
is that,
Mm-hmm.
you know, you can't drive yourself crazy about the unknown, because then it's
Yes.
just going to take up all your mental space.
Mm-hmm.
And that's something that it can consume you and into like, you know, a spiral. And that's really something that that's happened to me in the past, and that
Mm-hmm.
I've been able to prevent with, you know, just being more mindful and taking off your headphones sometimes and just, you know,
Mm-hmm.
noticing what's going on around you. And so I think we had end up being on the same journey of doing those things without like purposefully doing it together. But
Mm-hmm.
I think in the past few years, we've both really been working on that too. So I think
Yes.
that we've I think our relationship has grown because of that too. Like we are able to talk to each other on such a level-headed like way right now, like
Mm-hmm.
compared to that we have in the past. And I think that has to do with a lot of, you know, just being able to be mindful and be in the moment and kind of just worry about what's happening right now.
Yeah, a lot of inner work from both of our ends, you know what I
Hmm.
mean? And like you said, you know, not did it just improve our relationship, but it's also improved with other, you know, relationships and, you know, with your sisters or, you know, with whomever you're around. And I really think, yeah, it's beneficial for both patients and parents, and it's also a mindset change of thinking more positive than just dwelling on the negative. And as a patient, I think that's one good thing, one major thing that, you know, it would be good to change that mindset, because you really, and a lot of your healing would also eh, how is it to say, you know, your healing would be a little bit better with just a positive outlook rather than just being negative about things. And, you know, it just would be a good mindset change to just be focused on the positive. Whatever you're going through, just look at it from a different perspective. It's all about perspective, you know, and, you know, it's, I think that's what you did just a couple of years ago, just changed it all, I mean, you know, your perspective on things instead of just dwelling on all the negative stuff. After going through your lupus nephritis, you really just, okay, it's either I'm going to dwell on the negative side, or, you know, the woe is me thinking, or you can also be your own advocate and just take charge of what you can be, you know, in control of, and just make the best out of the situation. And I think when you did that turnaround on your own without me having to, you know, force anything down your throat, it made a big difference, because you started taking your medications consistently. You started doing a lot of research. And I think when you do it on your own, rather than, you know, force feeding it down, you know, with any facts or, you know, any articles that I would, if you just come across it on your own, I think you retain it better.
I think that's been a theme of my whole life, to be honest
Mm-hmm.
with you. I'm
You're
just so
stubborn.
stubborn. Yeah, no,
Yeah.
I'm just like you in that way, where I'm so stubborn
Mm-hmm.
that I really do have to learn those things on my own. And that's how I learn, is by learning from my own mistakes. And I think that's like we said, one of the biggest things is just like focusing on the things that you can control. You
Yep.
have to, you know, I can take my medicine every day. I can remind myself, and I can look into supplements that I think might
Mm-hmm.
help me. Like I take magnesium glycinate every night to help me calm down and relax and be able to get a full night's sleep. I used to get so anxious before I used to go to sleep, where I would be rubbing my feet together and rubbing my hands and just not being able to kind of relax. And so the magnesium glycinate in itself has been able to help my muscles relax and help my mind relax. And I
Mm-hmm.
think, you know, just, you know, like you said, doing research and like controlling what you can control, and taking ownership of
Mm-hmm.
what you can take ownership of, and letting go of all the other factors, so that you don't worry so much. It makes a really big difference in a lot of
Mm-hmm.
different ways in your life. And I wanted you to maybe go into a little bit more about what you talk about like during these coaching sessions, and how you approach these situations with your clients, and basically why should people invest in looking into coaching? Because as AiArthritis disease patients, we actually do have a lot of people that are trying to sell us coaching,
Mm-hmm.
coaching programs and things like that. And it's like, it can definitely help, but some people could be very skeptical. Like, why would I spend my money to do this? Like, what can it really do for me?
Mm-hmm. Well, the first step is to be open-minded as to, what are the other alternatives out there. Now, I get this question all the time is what's the difference between coaching and therapy? Therapy is focusing on certain things that happened in the past and just exploring more as to why you are the way you are, or why you do things the way you do things based on what happened in the past. Whereas coaching is more forward thinking, and it's all about goal setting. And I think for patients in themselves or the parents, coaching can be helpful when there's just to get them to a goal, like a simple goal. And what's good about the coaching, well, at least what I do, is that it's all client driven. And I open it up with what are your goals? What do you want to attain for the next 3 to 6 months? And we go forth from there. And whether it's self-care, whether you want to be more physically active, or if you want to delve into mindfulness, or just being more motivated into doing things. And it's really all up to the client. It's a client driven. And it's as a coach, we would co-create goals and plans and how to get there, as opposed to not just telling the client, oh, you need to do this, you need to do that. It's all about co-creating. And the most important part is it is client centered and client driven. So whatever that coach's niche is, and like myself, it's preventing, and for example, like myself, it's preventing or recovering from burnout. Then we would go through some pillars that I touch upon, which is like self-care, or mindset change, or setting boundaries. It just all depends on what the client or the patient wants to work on. And it's very beneficial because it gives them something to look forward to. And even the little wins between from the start to the end goal, it's worth celebrating. Because when you're going through something like a flare up, or just in the midst of doing all these having to get acclimated to maybe a new diagnosis, it is something for them to look forward to, as opposed to just dwelling on all these diagnostic tests or labs and whatnot. This is something different, just for their own, and something that they set on their own. And like I said, it's client driven, and it really gives them that authority to be on the driver's seat, but just with a coach helping and facilitate them towards that goal.
Yeah, I like to think it as like, therapy is good initially so that you
Mm-hmm.
can get to know yourself better.
Mm-hmm.
But in order to set forth those goals that you want to do to grow, I think that coaching is a lot better. I've been even myself, considering doing some kind of life coaching. I'm not sure exactly what
Mm-hmm.
kind of niche I really want yet, but I went through therapy. I did a lot of those types of things where you're learning more about yourself. And I feel like, once you're at that place where you have kind of battled with the demons of your past and have, put those things to rest, that you do need still help in order
Mm-hmm.
to move forward and see how more to progress in your life. And with patients that are going through, I've seen multiple different lupus coaches and autoimmune
Mm-hmm.
coaches where it's made specifically for maybe for women who just got a diagnosis and they're in their 20s or 30s, and they're coping with the fact that they can't go and party like they did before, and that they
Mm-hmm.
need to take care of their health. They're not a normal, average 20-30-year-old anymore. There's a lot that goes into that, having someone who's been in your shoes can
Mm-hmm.
really help with that situation even more sometimes than a therapist can help you with that. They can help give you some coping mechanisms and things like that. But to have someone who, might not have been on the exact same journey as you,
Mm-hmm.
but has, had something similar happen to them, it hits home a little bit more when
Oh yeah.
they give you that advice. And that's what kind of happens with your patients, with your clients that are nurses,
Mm-hmm.
and even other first responders that you
Mm-hmm.
may also take on too, that may be police officers, firefighters, 911 operators, which when we said before, when my mom wasn't a nurse, that's what she was before, was a 911 operator for San Francisco. And so yeah, I think that really does help to, like you said, distinguish the difference between therapy and coaching, and how coaching can benefit parents and patients and anybody who really is looking for change in their life. And of course, that all goes with checking their credentials, making sure that
Mm-hmm.
they are legit and that they have the certifications that they say they do,
Mm-hmm.
looking for testimonials and all those types of things, because sometimes there can be people who are trying to scam you. So you just want to be
Yes.
careful and really, maybe hear from word of mouth of someone that who knows someone who went to
Mm-hmm.
that coach and things like that, because there are a lot of people advertising online and things like that. So just to be safe, and do your research. I also wanted to give you the chance to kind of let everybody know where they can find you if they are interested in looking into coaching, your website, your social media, things like that.
Okay, so my website is www. Do you still say www?
No, you can. You still have to type it in sometimes. So yeah.
True. Coachingbymaravik.com. And Maravik is spelled Mari, V as in Victor, IC. Or I'm also on Instagram at Coaching by Maravik. That's my handle. And yeah, I would love to hear from anyone, or just even to chit chat, coming from a mom's perspective with a daughter that has lupus, or any questions that you might have. I'd love to help, just whatever I can.
Yeah,
Just
absolutely.
sharing our experience, and see if that can help someone out. That would be great.
Yes, and I also did help my mom create her website. So if you go on her website, just know that I created it and I'm very proud of it. But also I just wanted to say, tonight that we're actually filming this is the night before Mother's Day. So I just wanted to say happy Mother's Day, Mom, and I love
Ah,
you.
thank you. I love you too. And this has been fun. And I hope this, reaches out to those moms and with, lupus kids. And it's a hard journey, and it definitely will test your, um not just your relationships, but also the way you are as a parent, and how you want to portray to your kids. And it's really difficult, but at the same time, um it's nothing that you can't handle. It's a lot of communication and understanding. And just, if you do need help, whether it be through a therapist or a coach, or just even another family member, just to intervene, or just to help you, um it
Process.
yeah, to help you through the process, because it's not for the faint of heart. But then again, it's not something impossible to do. And look, we've come a long way. How many years, baby? It's since you were 12.
So 15 years that I've had
15
lupus.
years.
Yeah.
15 years. And it's just constant being your own advocate, doing your own research, and just having that communication. And I hope, this inspires those who are going through the same journey. And, let us know if we could be of any help.
Yes, absolutely. And like my mom said, you can find her at Coaching by Maravik on Instagram. And I also do share a little bit about my lupus journey on Instagram too, at lupuslifestyle.lay. And so if you want to find me there, all of our links will also be put in the YouTube chat during when this is going on. So, and I'll also be answering any questions in the chat. So please let me know if you all have any questions for us. at this time, so you can go ahead and type them in. And thank you so much, Mom, for being here tonight.
You're
I
welcome.
am so glad to have been able to have you a guest on here. I think it's nice that it's very personal, that we are able to have these types of conversations, because AI Arthritis is a patient-led and patient-run
Hmm.
organization. So everyone who works here does have a story just like mine. And I really do hope that you will see some of our other staff members during this raceathon being able to share some of their journey too. But really, working with AiArthritis has empowered me to be so much more involved in my own care, and to be able to help those who do need help with, trying to understand what's going on with them, with health education. I forgot to mention before that when I did go to college, I was a nursing major,
Hmm.
and that didn't really work out with my grades and with how stressful it was for me. And so shifting over to health education ended up being, the biggest blessing in disguise, so that I am able to help those that are on their journey just like I was, through programs like our AI Arthritis Voices
Hmm.
program, and our community chats that I have every month. I'm really able to, get some FaceTime with patients who do want to share their journey too. And so I'm really thankful to be here, and being able to share my journey too. So thank you all again for watching, and have a great rest of your night. There's so much more content to come. So please stay tuned. Alrighty, have a
Bye.
great night.